some meds.
Hi there, I'm Nurse Megan, and I have a nursing student with me today.
Hi.
She's just going to sit in and watch us. So you have a little bit of a cough going. Is there anything that really hurts?
Just my throat in general. It's been a couple days.
And then you're the mother, correct?
Correct.
Have you noticed how long this has been going on for?
I would say 3 days.
3 days? Okay. Well, we sent a specimen out to the lab, so hopefully we'll get something back. When it does come back, we're fairly sure that it is tonsillitis, and we do have some medications that we can actually start him on now as a preventative measure. So all I have to do is confirm your 6 rights. So we want to make sure we get this in the computer.
Okay.
And what we're going to do is we're going to scan his armband in, and then after that goes through, I can give you your medications. Can I get your first and last name?
It's Jimmy Jones.
Okay. And can I get your birthday?
September 12th, 2000.
Okie dokie. And let me get this into the computer. Let's pull up your chart. Well, that's different. The computers aren't working right now. If you'll give us a second, we'll see if we can get something pulled up, and if not, it looks like we'll have to do some paper charting to kind of subset the wireless not working.
Okay.
I'm so sorry to keep you waiting.
It's okay.
What are we going to do?
Well, in times like this, nurses haven't always used computers. I mean, nursing's been around for quite some time.
Okay.
So we do have paper charting to fall back on. So from there, we'll actually just go down to the pharmacy and get some paperwork,
Okay.
and then we'll fill out, do our 6 checks and make sure it's the right medication, the right route, right dose. I mean, normally the computer would also help us facilitate in that process, but we do have the capabilities to do it without technology.
Okay.
Technology does make it a little bit easier for the sake of they can make sure that there's no contradictions and help us facilitate a little bit more information.
Okay.
If not, we can always follow up on our drug books that we have sitting over there, and that way we can always give you guys some more information. Okay, so now we're going to give the pharmacy a call. I wanted to do it privately in this room to protect our patient's confidentiality because we do want to still follow within HIPAA regulations.
Okay.
I'm going to give the pharmacy a call and see what we can do for our patient.
Okay.
Hi there, this is Megan from 6th East. I was just giving you a call because I have a patient that's up here who could really use his medication. Unfortunately, our computer systems are down, and I have let our nursing informatics team know that they are down. They said it should be up in a few hours. Unfortunately, our patient's medication is due at this moment, so we'll need to do some paper charting to make sure that he does get his medication on time. The medication is for Jimmy Jones. His birthday is September 12th, 2000. We just like to get his antibiotics started and sent up here right away. I was wondering if there's any way that you could do that for us.
Yes, Megan, this is pharmacy. Yes. Yes, those were the 6. Yeah, those were the 6 rights of the patient. Yes. Do you happen to know at what time the patient is due? Okay. So this is what we're going to do. I will continue the medication, and because the system, like you said, is down, what I can do is paper chart it, and once the computer, what is that? Yes, once the computer is up, you can put it into the computer like a normal prescription, and it'll get right to me, which will be perfect, and I can just submit it, and the doctor will even see that the prescription has been given. So thank you for letting me know.
Well, did you have any questions about what I just did involving the information for me calling pharmacy and how to use paper charting?
Yes, I actually do. I just wanted to know, why is HIPAA so important in the healthcare setting?
Well, on a technology standpoint, it's always growing, so we want to make sure that we are growing with the times and keeping our security measures up to date. Our hospital does a really good job keeping your guys' personal information safe because nobody wants their information sold to private companies, and because it's very personal information, you never know what can happen. So we take extra measures to have firewall systems built into our computers to make sure nobody can have access to your information. So we were able to get your son's prescription so that way he could have it on time, so that way you guys can go home and not have to wait and go to your own pharmacy. I just need to get a little bit more pieces of information before I hand it to you. Can I get your name again?
Jimmy Jones,
And can I get your birth date?
September 12th, 2000.
Perfect. Well, this antibiotic will be perfect for fixing up your tonsillitis. I'm just going to give it to your mom. You can make sure to give it to him every 6 hours. And don't forget, take it all, because if you miss a dose, it may come back and then the antibiotic won't be effective anymore.
Okay.
Did you have any questions for me?
Yes, I heard that lately you can see online about his medical records and things like that.
Yeah, we definitely have a new system now. We have the electronic medical records and EMR. Hospitals can actually share with outlying other hospitals information about patients. So if you go to another hospital, we can send your records electronically over. But another great thing about it is they've made it to where you can have access at your own homes to your own records. So if you're curious, like, oh, I know he was at the hospital during this time, but I don't remember the exact date, you can actually sign on with your own username to the area you were at to get your patient information and pull up your records from there.
And how do I know, like, who sees that?
It's just you and your physician, who's ever treating you at the time. Because we're not allowed to go back and look at patient information unless they are in our hospitals, or else that's violating HIPAA violations.
Okay.
Well, thank you for coming by. I hope you start feeling better. I know you have that little tickle, and sometimes it just throw off your whole day.